In this session, we will discuss regarding the microanatomy of large intestine and appendix. The large intestine consists of the cecum, vermiform appendix, and colon. So, colon has the following parts like ascending colon, transverse colon, descending colon, and sigmoid colon, rectum, and anal canal. So, all these are the parts of the large intestine. There are three cardinal features of large intestine, namely the tinea coli, hastrations, appendices epiblaica, otherwise called as omental appendices. Large intestine performs absorption of water and electrolytes and production of mucin that lubricates its contents. You can see this is the appendix, this is the ileum, which is the last part of the small intestine. Ileum opens into cecum. So this is the cecum, this is the ascending colon, this is the transverse colon, this is the descending colon, this is the hepatic flexure, this is the splenic flexure. So this is the sigmoid colon, this is the rectum and anal canal. You can see here from the base of the appendix, you can see the tinea coli, which are starting here, and you can see these are the peritoneal pockets of fat called um, appendices epiblaicae, and these are the saculations and hastrations. So the length of the tinea coli is shorter than the remaining layers. So that's why the large intestine shows saculations and hastrations. So you can see the mucosal surface of the large intestine. So it does not have any kind of plica layers, or it does not have villi, so it appears smooth. You can see the openings of the crypts of liver cone. This is the lining columnar epithelium, this will be the lamina propria, this is the muscular mucosa, and this is the submucosa. Basically, the microanatomy of the large intestine presents four layers, namely the mucosa, submucosa, muscularis externa, and serosa. The mucosa will have the lining epithelium, which is a simple columnar epithelium, and it also have number of goblet cells. The epithelial cells show microvilli, so they appear like striated border. So these are microvilli are present only on the absorptive cells. Plica circulars, which are the mucosal folds, and villi, all both of them are absent. Mucosa of the large intestine has smooth surface because these two are absent. Paneth cells are absent. These are the zymogen cells which are present in the small intestine, but in large intestine, Paneth cells are absent. The lamina propria is occupied by short, simple tubular intestinal glands, otherwise called as crypts of liver cone. These glands are lined with simple columnar epithelium and many goblet cells. The surface epithelial cells and goblet cells have a lifespan of 5 to 6 days, whereas the enteroendocrine cells lifespan is around 4 weeks. Lamina propria shows collagen table. So this is very thick collagen fibers. They regulate the transport of water and electrolytes. So around the intestinal glands, that is the crypts of liver cone, there are pericryptal fibroblast sheath which is present in lamina propria of colon. These fibroblasts replicate and migrate towards luminal surface and may differentiate to form macrophages. Lamina propria shows discrete lymphatic nodules that are regularly spaced. So wherever these lymphatic nodules are present, the lining epithelium shows M cells or microfold cells, which are antigen transporting cells. The submucous consists of dense irregular connective tissue. Muscularis externa, it has inner circular layer and outer longitudinal layer. The longitudinal fibers form three thick bundles called tinea coli. So due to a shorter length of tinea coli and other layers are longer, the large intestine shows saculations. Serosa, the pockets of fat which are lying over the large intestine, these are called as appendices epiblaicae. You can see here. So this is the lining epithelium. These empty cells are the goblet cells. You can see here, these are the crypts of liver cone, simple tubular glands. You can see these are the pericryptal fibroblast sheets. So this is the lymphatic nodule in the lamina propria. This is the muscularis mucosa. This is submucosa. This is the inner circular layer. This is the outer longitudinal layer. You can see here it is thinned, but here it is thickened to form the tinea coli. And you can see here this is the serosa. So mucosa, submucosa, muscularis externa, and serosa. So just to revise, mucosa, simple columnar epithelium, goblet cells, then simple tubular glands, crypts of liver cone, lamina propria shows discrete lymphatic follicles, and muscularis mucosae. Submucosa will have connective tissue. There are no Brennus glands or Peyer's patches like in duodenum or ileum. Muscularis externa, inner circular and outer longitudinal. Outer longitudinal is thickened at 3 places to form tinea coli. So serosa, connective tissue layer, partly covered by mesothelium. Then colon do not have plica circularis or villi and Paneth cells. You can see here the slide. This is how the actual slide looks. You can see more number of goblet cells. You can see this is a muscularis mucosa, this is submucosa, this is the inner circular layer, this is the outer longitudinal layer. You can see enlarged photograph of the crypts of liver cone. These are the goblet cells. You can see here these are the goblet cells. What is the difference between small intestine and large intestine? Small intestine will have narrow lumen, large intestine will have wider lumen. Villi are present in the mucosa, villi are absent in the mucosa of large intestine. Crypts of Lieberkühn contains columnar cells, goblet cells, and also Paneth cells. In the large intestine, Paneth cells are absent. Numerous pairs patches in the ileum along antimesenteric border. Lymphatic follicles dispersed along different parts. Tinea coli are absent. Tinea coli are present in the large intestine. Formiform appendix. The blind and the tubular appendix extending from cecum. It is the narrowest part of the intestine. Again, this also has four layers: mucosa, submucosa, muscularis externa, and serosa. Mucosa is lined with simple columnar epithelium with microvilli, goblet cells, and M cells. Lamina propria contains short tubular intestinal glands lined with simple columnar epithelium with goblet cells. Lamina propria is mostly occupied by large and small lymphatic follicles that even may cross muscularis mucosa and extend into submucosa. Muscularis mucosa is disrupted at many places by lymphatic follicles that extend into submucosa. Submucosa, it consists of connective tissue. Many lymphatic follicles extend from lamina propria to submucosa. Muscularis externa, inner circular and outer longitudinal muscle coat. Note, though the appendix is the part of large intestine, it does not have tinea coli. So serosa covers on all sides except the attachment of mesoappendix. So mucosa, lining epithelium, lamina propria and muscularis mucosa. Lining epithelium with simple columnar epithelium with goblet cells. Lamina propria, simple tubular glands with numerous lymphatic follicles. Muscularis mucosa has inner circular and outer longitudinal layer. Then the submucosa is having lymphatic follicles extending from lamina propria. Then muscularis externa, inner circular and outer longitudinal. And there is serosa or adventitia. It is only the serosa. Majority of the times it is a serosa. You can see here these are the less developed tubular glands. The lining epithelium simple columnar with the goblet cells. Here you can see the lymphatic nodules present within the lamina propria as well as they are extending into the submucosa. This is the discontinuous muscularis mucosa. This is the submucosa. This is the inner circular layer, outer longitudinal layer, and this is the serosal layer. This is the lumen of the appendix. So this is how the slide looks. See the in simple tubular glands which are less developed when compared to the large intestine. You can see the lymphatic nodules extending from lamina propria into the submucosa. See disrupted muscularis mucosa. Rectum is also a part of large intestine. So mucous membrane has temporary longitudinal folds and permanent horizontal folds. So these are called Houston's valves. So Houston's valves has mucosa, submucosa, and thickened circular muscle coat. Tinea coli and appendices epiblica are absent. Peritoneum covers front and sides of the upper one third of the rectum, and only the front of the middle third of the rectum. Remaining part of the rectum is not covered by peritoneum. You can see here these are the Houston's valves. So this is the anal canal. So anal canal is the terminal part of intestine. Length is 4 centimeters. The anal canal shows 4 layers: mucosa, submucosa, muscularis externa, and adventitia. You can see here the lining epithelium of anal canal shows transition. Like in the upper one third, it will be simple columnar epithelium. In the middle one third, it will be non-keratinized stratified squamous epithelium. In the lower one third, it is below the pectinate line. It's keratinized stratified squamous epithelium that is almost like skin. Mucous membrane of upper one third shows 6 to 12 longitudinal folds called anal columns. It also shows a few short intestinal glands. You can see here these are the anal columns which are joined by anal walls. Above the anal walls, you can see these are the anal sinuses where circumanal glands open. So this is the pectinate line. Here you can see this is the white line of Hilton. So pectinate line acts as a watershed line. So at the junction of upper and middle third of the anal columns used to form transverse folds called anal walls along a line called pectinate line. So middle one third of the anal canal has bluish appearance due to presence of the deeper dense venous plexus. The junction of middle and lower one third is represented by a white line of Hilton. Above the anal walls, there are depressions called anal sinuses. Apocrine sweat glands, circumanal glands open into each sinus. The submucosa contains numerous venous plexus called hemorrhoidal plexus, internal hemorrhoidal plexus above the pectinate line and external hemorrhoidal plexus below the pectinate line. Muscularis externa, the anal canal has inner circular and outer longitudinal smooth muscle fibers. Thick circular smooth muscle layer forms the internal anal sphincter. Outside muscularis externa, a layer of skeletal muscle fibers is present. These fibers form the external anal sphincter. Adventitia, surrounding anal canal is a connective tissue. You can see here mucosa in the upper one third simple columnar epithelium, middle one third non-keratinized stratified squamous epithelium, lower one third keratinized stratified squamous epithelium. Submucosa, hemorrhoidal venous plexus, muscularis externa, thick circular smooth muscle forms the internal anal sphincter. External skeletal muscle fibers are present which form the external anal sphincter and surrounded by adventitia. There is no relationship with the peritoneum here. So applied aspects: Fistulas, these are the communication between perianal skin and the anal canal. Internal hemorrhoids, which are due to dilatation of superior hemorrhoidal plexus. External hemorrhoids, due to dilatation of inferior hemorrhoidal plexus. Adenocarcinoma of the colon, malignant tumor of the intestinal glands. Ulcerative colitis, inflammation and ulceration of the mucosa and submucosa of the rectum and especially the descending colon. Diverticulosis, herniation of the mucosa and submucosa of colon between tinea coli. Crohn's disease, inflammatory bowel disease affecting the ileum and colon. So if you see here, you can see here this is the internal hemorrhoids, these are the external hemorrhoids above the pectinate line and below the pectinate line. Here you can see the fistulous tract connecting the perianal skin with the anal canal. So here you can see the diverticulosis or diverticulitis. So here you can see this is the Crohn's disease involving different segments in the large intestine. But here you can see the ulcerative colitis involving especially the rectum and the descending colon. Thank you.